Progress towards universal health coverage and sustainable development goals is a challenge for most countries. Health workers are fundamental in achieving these goals, but their distribution is highly uneven. International migration of health workers is a widespread and growing phenomenon that is contributing to exacerbation of workforce inequalities across the world. For example, the National Health Workforce accounts show that OECD countries host more than 1.1 million migrant nurses. This is more than the combined number of nurses in 55 countries that face the most pressing health workforce challenges. Excessive international health worker migration can be a sign of labor market failure. Increasing international recruitment is a common response to inadequate domestic production or retention of health workers, especially in high-income countries. On the other hand, many low and middle-income countries have limitations in employment capacity and working conditions that lead to workforce attrition and health worker migration from these countries. To improve governance of health worker migration and to minimize its negative consequences, in 2010, the WHO Global Code of Practice on the International Recruitment of Health Personnel was adopted by the World Health Assembly. The Code is an international instrument that links ethical health worker migration with health system strengthening. Although it is a voluntary instrument, the reporting on its implementation is mandatory. So far, there have been 4 rounds of reporting and 2 reviews on the relevance and effectiveness of the code. The last review provided specific recommendations to WHO to facilitate implementation of the code. The reporting from member states show that there have been variable progress on the implementation of the different components of the code. While many countries have reported policies for equal opportunities for migrants and nationals in education and career progression, there have been limited progress on the regulation of private recruitment agencies with requirement for ethical certification. Notably, most countries require support to strengthen implementation of the code. The code explicitly discourages active international recruitment from countries with critical shortage of health workers. The WHO Health Workforce Support and Safeguards list identifies these countries to be prioritized for investment for health system strengthening and health workforce development. Among the 55 countries in the list, 37 are in the WHO African region. International recruitment from these countries is not banned but encouraged to take place through government-to-government agreements. Such agreements should be informed by a health labor market analysis to ensure that the domestic supply of health workers being recruited is sufficient. Engage health stakeholders, including ministries of health, in the negotiation process, and specify the benefits to the health system of source countries proportionate to the benefits to destination countries. These recommendations can be extended to other low and middle-income countries. At the specific request of member states, WHO, with the support of the Working for Health program, has developed a guidance that provides policy and implementation considerations to help countries create a new generation of bilateral agreements that are fair, ethical, and keep health system priorities at the fore. The policy considerations emphasize on agreements to specify mutual and proportional benefits to health systems of both source and destination countries, include safeguards for countries with workforce vulnerabilities, ensure equal treatment of migrant and nationals, and address gender needs. All agreements should also have monitoring and evaluation mechanisms, and related information and data should be shared with WHO. Migration is an ongoing phenomenon. Governance of health worker migration can minimize the negative consequences and ensure benefits to health workers and health systems of both source and destination countries. Health worker migration is part of the broader health labor market dynamics and cannot be viewed in isolation. The policy response to mitigating the negative effect of migration requires all countries to increase investment in health worker education, employment, and decent working conditions to meet their domestic needs. International cooperation on health worker migration can help countries in the support and safeguards list as well as other low and middle income countries to advance towards their health goals, thereby contributing to progress towards UHC, SDGs and global health security. For more information on the code, please visit our website or write to us at who globalcode@who.int.